Welcome, everyone, and thank you for joining us today to discuss strategies on how to care for your emotional and physical health during this challenging period. We all know everyone is dealing with a lot emotionally, socially, possibly even financially and otherwise. You may be adapting to new routines, working from home, having some financial stress, dealing with children, taking care of older adults in the community or in your family. And definitely, we all have been dealing with some uncertainty about what's going to happen next. At EHE Health, we're here to help. We want to give you some positive resources and practical tips on how to help you thrive during this period, as well as provide some guidance and things that you can do to prevent any mental health issues, share some tips on how to recognize when yourself or others may be facing a mental health concern and may need additional help. At the end of this webinar, we'll be answering your questions using the Q&A button at the bottom of your screen, and that's where we'll be able to address any concerns or questions you may have to myself and my esteemed panelists. After the webinar, if you have any additional questions, please feel free to reach out to us at our COVID hotline. You can call toll-free at 844-258-1820. That's 844-258-1820. Or email us at COVID19@EHE.health. If you've had an EHE preventive exam, you're eligible to speak with our panelists and other health mentors by emailing mentorme@EHE.health. That's MENTORME at EHE.health. We also have a COVID health portal with additional information at COVID19.EHE.health, and with many resources to help support everyone during this time. So let's get started. First of all, I'd like to introduce myself. It's a pleasure to speak with you all today. Here's a little bit about my background. My name is Dr. Seema Sarin. I'm the Director of Lifestyle Medicine at EHE and an Assistant Medical Director. I am a proud product of George Washington University and Johns Hopkins. I received both my undergraduate degrees in biology and psychology with honors at GW, and I completed my residency at Johns Hopkins in Baltimore. I hold 2 certifications, both in lifestyle medicine and internal medicine, and I've had the privilege of seeing patients at EHE for over 5 years and have more than, 15 years now of clinical experience and counting. Again, it's my pleasure to speak with you all today. I also want to introduce 2 of our accomplished EHE health mentors who will be joining us during this discussion. Both of our health mentors coach EHE patients every day on how to optimize how they eat, think, and move, and they're experts in their fields as well. Athir Yaqub is a registered dietitian with a Master of Science in Nutrition Education who has experience in counseling diverse populations in the areas of weight management, diabetes, cardiac diseases, and medical nutrition therapy. She's been in the field for 10 years at EHE. Athir, if you wouldn't mind saying hello.
Hi, everyone. It's a pleasure to be here.
Excellent. Janine McGowan is our other panelist. She is a registered dietitian and certified diabetes educator, bringing 8 years of experience to EHE's Health Mentor program. She's worked as a clinical nutritionist who counsels patients on a one-on-one basis at multiple health centers across the nation. Go ahead, Janine, and if you wouldn't mind saying hello.
Hi, everyone. Thanks, Seema.
Excellent, great. As you will all see, both Athir and Janine have a passion to promote holistic wellness to maximize every person's quality of life, both inside and outside of this COVID pandemic. Thank you all. Thank you both for joining us, and thank you to everyone who's joining us on this webinar today. We really appreciate you discussing these challenging times with all of us. The first topic of discussion that we'd like to kind of go over today is just a general concern. So as people are working from home, we're adapting to new routines, we're practicing social distancing, and getting a lot of information about COVID-19. I wanted to talk about some evidence-based ways to cope effectively and thrive. At EHE, we focus on how to optimize how patients eat, move, and think. And so I want to direct this question to our health mentors. Athir, how can we cultivate social support in this time of social distancing and also seeking good nutrition?
Yeah, thank you, Seema. So I know right now, especially in the time of social distancing, it can feel like we're isolated, we're not able to physically see our friends and some family members, but that doesn't mean we have to forego all social interaction. Luckily with technology today, there's so much that we can do to stay connected. So for example, maybe, when you go on a walk, you can call a friend or maybe, schedule a video conferencing one-on-one or with multiple friends and kind of do a hangout or maybe like a virtual dinner together. So just because we can't physically be together doesn't mean that, we can't stay connected and have social interaction. And then if you're at home with your family, there's also lots of things that you can do together and maybe use this time to really bond and try to cultivate healthy habits together. So you can go on like a family walk, or plan like a healthy meal together, or even if you just want to have some fun downtime, there's board games or puzzles and lots of things that you can do together, just stay connected and feel like, even though you're social distancing, you're not socially isolated. So I think that's really important. And as far as, good nutrition goes, it's more important now than ever because we really want to try to maintain good health, really focus on prevention. And especially during COVID-19, everyone's lives kind of got upended and we're at home and our meals might get erratic and your schedules kind of flipped and changed. So it's really important to try to establish some sort of regular routine. So just trying to stick to our regular meal times as you would, when you're at the office. So, make sure that you do take time out to eat breakfast, lunch, and dinner, and, maybe have one or two healthy snacks in between if you do feel hungry. It's also important just to be mindful of when we are snacking. It can really be easy to kind of stress to eat or, if you're feeling emotional and there's snacks at home, to just go to that as your first source of comfort. But if we are just more aware of the reasons that we're eating and whether or not we're actually hungry, that can help cut down on some mindless snacking. So one helpful thing that I'd like to share with you is an acronym called HALT. And this is to help you just kind of stop, think, and assess like whether or not you're truly hungry or trying to seek comfort from something. So HALT stands for, we want to ask ourselves, am I hungry? Am I angry? Am I lonely? Am I tired? And of course, the list of emotions goes on from stress, boredom, and all of these things that we might be experiencing right now. So if we just kind of stop and assess just to make sure whether or not we're hungry, that can definitely cut down on any unnecessary snacking, which also doesn't make us feel good because we're going to, probably go for those like sugary comfort foods that make us feel even more sluggish and tired and harder to focus and concentrate. And it's really important to maintain good portions during this time, especially since we're probably not moving as much. And one helpful method to make sure that you're eating a balanced plate it's called the My Plate method. So, if you're looking at like a standard 9-inch dinner plate, well, you want to split that into 3 parts. So half of our plate, ideally, we want to fill with vegetables. Green leafy vegetables are always great, like spinach or kale, or other green vegetables like broccoli or asparagus. And you can buy your vegetables frozen or fresh. Frozen can be just as nutritious as fresh. Especially during this time, we want to probably limit the times that we go to the grocery store. So getting frozen vegetables, it will last longer. You don't have to worry about it going bad and having to make multiple trips. So that could be one option. On the other side of our plate, we want to split that into 2 quarters. So 1 quarter will be for our lean protein, which is chicken, fish, turkey. We can even go for plant-based sources of protein like tofu or beans or lentils and legumes. And also the beans and legumes, they can be purchased either canned, or dried, and both, are non-perishable and last. Just if you go for the canned, make sure that you rinse off the water to get rid of all of the excess sodium that's used as a preservative. And then the last quarter of our plate, that's where our carbohydrates go, bread, rice, pasta, any kind of grains. And we want to aim for at least half the time, try to get in those really good whole grain sources of carbohydrates. So that can be like quinoa, bulgur, farro, or maybe even whole grain pasta. There's even like lentil pasta and chickpea pasta now. So you can have both protein and healthy carbs together. And there's a lot of really great information out there on healthy and balanced eating with the My Plate method and all of these things on eatright.org website. They have lots of great resources on there. And another just helpful tip is just to be mindful of alcohol, because again, just like snacking or just like anything, we might be reaching for those comfort things that might not be so healthy for us. So if you are drinking, just make sure, we're limiting to 1 drink a day for women and no more than 2 drinks a day for men. If you do find yourself that you're struggling, with alcohol, tobacco, or substance abuse, luckily there are some really great sources out there. There's the Substance Abuse Mental Health Services Administration, which is found at www.samhsa.gov. And then they also have a national helpline, which is 1-800-662-HELP. So you're not alone. There's lots of resources. We're here for you. And right now, we just want to put our priority into our health.
Those are great tips, Cynthia. Thank you so much for sharing. Definitely thinking about what we're eating, how nutritious the foods that we put in our bodies are, and how it affects our mood and so many other things as well is important. It's funny how you mentioned, spending quality time with family. We, in our family, we've decided to do a family band. And we've called ourselves the Quarantones. So we're all, singing Brown Eyed Girl together, playing keyboard and euphonium and piano and things. So definitely use this time, be creative, and appreciate the time that you have kind of connecting to others, whether it's through video visits and chats, looking at your nuclear family if you're with your family, and really trying to seek out creative and innovative ways to connect and enjoy the time that we have. So Janine, I was wondering, can you give us some insight on how we can move regularly? We talked about nutrition and stress management a little, but how do we, move and incorporate these things during this time home? And then also, on the other hand, when we're moving regularly, how do we keep good sleeping habits?
Absolutely, Seema. Thank you very much. So during this time, we want to keep our regular scheduled exercise. That would be 30 minutes daily, or at least 5 days a week, to get that 150 minutes recommended exercise, mix of cardio, mix of strength training. We want to keep that going. But what you might find during this time is that we have a decrease in our non-exercise movement as well, because we're just not doing our daily commute, taking the kids to school. So we have to actually focus on the non-exercise movement. And what I mean by that is the walking, the fidgeting that you would do at the office. And now that might look like a little bit of cleaning during the day. So keeping movement during the day is really important, additionally to the exercise. And that exercise is also going to look different during this time. We don't have access to the gym, but luckily today with the internet, we can access our local instructors, our local gym through Facebook Live. A lot of people are streaming classes live, so we still get that motivation. We have that group effort to stay healthy, to stay active. There's some great resources with apps. Nike Training Club is offering their premium for free, which can give you a lot of different movement and tips. Fitness Blender as well, if you haven't been to that website, is a great one to use, because you can plug in how much ever time you have, what equipment you have, whatever type of exercise you enjoy doing, and take control and use that time wisely. It doesn't matter what you have in your home, you can still move your body. And similarly with the non-exercise movement, incorporate that into your schedule. Walking while you're on the phone, if possible, using a side step movement as well. While brushing your teeth, do some squats. It may even be being more physically active with your children, dancing with them, being silly with them. These all count towards that non-exercise movement. But exercise is going to help you continue to not only work towards your goals, such as maybe a weight loss goal that you have, but on a day-to-day basis, this is going to boost your energy. It's going to boost your mood. I know for me personally, if I don't move, I start to feel sluggish. I start to feel like I can't focus. So increasing your energy, taking breaks to go for a walk is going to boost your mood more than going and grabbing a candy bar. And so that's going to help reduce stress daily in your life. And something similar to reducing stress is getting good sleep. Because when we have poor sleep habits, our day-to-day can become a little bit more of a struggle. So during this time, our sleep schedule is really important. It might be tempting without the commute to sleep in, to go to bed later, but that's actually not recommended at all. We get better sleep, better quality of sleep when we keep a natural circadian rhythm. And so going to bed at a regular scheduled time helps us get that good quality of sleep. During the day, we want to take action to help us get that good quality of sleep as well. So for me, it's stopping drinking caffeine before noon. At least by 2 p.m., we want to make sure that we're not having a lot of caffeine. Alcohol as well, even though you might feel sleepy after having a glass or two of wine with dinner, studies show it actually reduces the quality of sleep that you have. So you're more wakeful at night and not getting a restful sleep. Eat a balanced meal, just as Athir talked about. We want to make sure we use that plate method so we're not overly hungry or overly stuffed that could cause discomfort as we try to go to sleep. But more importantly, this is going to holistically help you spiral up for the whole day. When we get good sleep, we feel better overall. It's going to help you move more. It's going to help you take on the day and some stresses that come along with these days.
That's really great. Thinking about sleep as well, something to consider is most people need 7 to 9 hours of sleep, so keeping that in mind. And then with exercise, what the American College of Sports Medicine and the many national organizations recommend is that 150 minutes of exercise per week. So make sure you do a mix of cardiovascular exercise, as Janine was mentioning, stretching, strength-based exercise, and balance. So really getting that full exercise routine in when you do carve out that time during the day, as well as keeping active through doing including movement throughout your day, as Janine so eloquently laid out for us. So this is to both Janine and Athir. This is, again, great practical advice. But how do we adapt these new habits and make them routine? I think that's a lot of the challenge that we face since we're adapting so many new routines now, maybe changing our schedules, working from home.
Yes, our routines are going to look a lot different, and even our goals maybe that we set out in January to achieve, we can't even use the same strategies to achieve those goals. There's no gym right now, there's no place to go exercise. So we have to make sure right now our goals are achievable. They are very specific for our day. And the big goal that you set in January to, for example, lose 50 pounds or be the best you, these are great goals to have, but if we break them down into bite-sized pieces, into what are we going to do on a day-to-day basis that's specifically helping us take those small steps towards our goals, is going to be the important part to focus on and not get lost in the overall goal. So break it down into that small goal that you can achieve on a day-to-day basis. If it's including a little bit of physical activity, how do we get it in? When do we get it in? And how do we measure how much we're doing? Another strategy you can employ is creating that environment in your home that helps you keep that healthy activity. If you're trying to eat healthy, during this time, we don't want to fill our house with those foods that are tempting to overeat, to snack on during the day. We want to push the fresh fruit forward in the fridge. We want to have those healthy snacks there present, and push the stuff maybe that you have to keep for other family members there in the back, out of your mind, out of your sight, and if possible, just not purchasing some of those food products that we tend to go and gravitate towards. Similarly, like if you want to keep sleep as a goal and getting good sleep, make sure we try to separate our environment from work. So if you can, keep your work environment in a separate place that you sleep in, so that we do associate that environment with sleep. So having that environmental component is really important. Some people like to also put their new activity with one that they already do. I mentioned, brushing your teeth and doing some squats. So you're gonna brush your teeth. That's actually a habit that you do. You don't even think about it, but it's something we've learned from, childhood. And when you are developing a new habit like that, when it's thinking about brushing your teeth, you had a lot of support during that time. You had a parent telling you to do it, reminding you, giving you colorful toothbrushes to do it. And that's kind of also what the health mentorship here at EHE can do. We're here to partner with you to help you work through goals, see what's achievable, and hold you accountable to those goals as well.
That's great, and that's a great recipe, for success as we adapt these new lifestyle, these new lifestyles in this setting that we are in right now. So eating nutritiously, exercising regularly, sleeping appropriately, cultivating the social support, it has a positive impact that stretches beyond this difficult time. It really supports immunity, it promotes our health, it reduces the risk of lifestyle-related diseases like diabetes, cardiovascular disease, obesity, and stroke. And now that we have this time, we can use it to optimize our health and refresh and adjust our normal day-to-day habits. So, with that in mind as well, what are some practical ways, perhaps Athir might be able to elucidate this, what are some practical ways we can recognize and minimize stressors, especially in this time of being bombarded with sometimes troubling news from all over?
Yeah, thank you, Seema. Absolutely. I think right now, especially, we are just inundated with news and stress, and there's like this mass kind of hysteria, panic, and we have to, kind of create some sort of level of, barrier between us and the outside stressors and try to kind of preserve our inner peace. So one way to do that, starts from the moment we wake up, so rather than look right at our phone and see, all the news, and maybe you're seeing all these work emails and you start getting worked up before you can even start working or before you've even started your morning. That's not a healthy way to start the day, because it just makes us feel chaotic, and that chaos can go into the rest of the day. So we want to start off with a peaceful morning routine. Maybe try meditating for even 5 minutes a day can be helpful. Maybe do some stretches, a little bit of breathing. And we want to make sure that we're using our breaks, mindfully and wisely and constructively. So it can really be easy to just kind of scroll all day through social media and kind of get lost in that. But that's not a really helpful, purposeful way to spend our time. So maybe keeping a limit. So if you take a break, say, okay, I'm going to spend 10 minutes on social media, and I'm going to, avoid looking at the news all day, every day, because it's not really going to change, that much day to day. And maybe just checking the news once or twice if you need to, but also making sure that we're, going to trusted sources for the news. Look at the CDC website. Also on EHE website, we have lots of great resources on COVID-19. So you can refer to, your trusted healthcare practitioners for that kind of news. But we really want to make sure that we're using our breaks wisely to decompress. There's a really great breathing technique that I like to use to help release some stress and anxiety and tension. And it's called the 4-7-8 method, and it focuses on rhythmic breathing. And I invite you all to do this with me at home if you want to follow along. It's super simple. So feel free to just get in a comfortable position and close your eyes if you'd like. It can be really helpful. And first, we're just going to take a long, deep inhale, and then exhale just with a sigh at the end. Just let it out, empty your lungs, just be present in this moment. And so with the 4-7-8, okay, we're going to start now by taking a slow, deep inhale through our nose for 1, 2, 3, 4 counts. Hold for 7, 6, 5, 4, 3, 2, 1. And release with an exhale, 1, 2, 3, 4, 5, 6, 7, 8. So you inhale for 4 counts, hold for 7, and exhale through the mouth for 8. And even at the end, what can be helpful is making that sigh at the end or like a whooshing sound. It helps just empty all the lungs of air and stress and tension. You can even use a visualization when you inhale, kind of imagining like a wave of calm coming over you. And then when you exhale, just imagine all the negative emotions and negative feelings kind of being pushed away. You could do this for 4 cycles or until you start feeling that relief. But it also can help regulate your breathing, which is super important right now, especially you might feel yourself tense and you might not even notice that you're feeling tense until you start purposefully breathing. So that's just one of many other breathing techniques, and there's lots of resources out there too if you would like to start meditating, like the Calm app or Headspace, or there's tons of YouTube videos just as an introductory to meditation. So don't feel intimidated. You've already done one type of meditation. So that can be a better use of our time than kind of just looking at the news all day, which just adds more and more stress.
Thanks, Cynthia, for that breathing exercise. That's actually one of my favorites. Just an easy thing you can do with no equipment. You don't need an app. You just can, you can focus on your breath. And to speak a little bit about getting away from it all and turning off the news, turning off notifications, stepping away from social media, to help you clear your thoughts, be present in the moment. You know, finding time and finding things that, just as Athir spoke about, they don't necessarily numb you, but they help you relax and actually help you feel positive beyond just that moment. You know, binging a TV show feels good sometimes, but often doesn't even feel that great afterwards. So doing something like taking a bath, journaling, coloring, connecting with people in your home can actually lift you up for much longer than just in that moment. And another thing I want to add is that I was speaking with someone today, and she kind of know that she felt guilty about focusing on self-care during this time. And I just wanted to say that you don't have to feel guilty about focusing on self-care, because when you focus on yourself and your personal health, you're actually helping everyone around you, because we're all in this together. And if you're feeling good and feeling positive, you can help support someone who may be struggling during this time. And hopefully from the self-care that you give, that can overflow into your community. Also, just being healthy is a way that we're gonna help stop this thing altogether. So definitely don't feel guilty about taking care of yourself. Please do that. Please focus on your self-care during this time.
Yes, that's great. I love talking about self-care because it is really important and should be a priority for all of us. You know, you have to be kind to yourself in order to be kind to others as well. So, you know, I appreciate both Athir and Janine, this discussion about minimizing stressors and how to really optimize our emotional health. And I love that breathing exercise as well. That 4-7-8 definitely, you know, even calm my own nerves, you know, as we were doing that exercise. The next part of my session here, the session that we're discussing today, is I wanted to talk about the signs that we should be aware of when we're thinking about mental health. And I think this one would be for me. You know, mental health disorders and disease are very prevalent in the US and worldwide. In fact, the World Health Organization states that 1 in 4 people in the world will be affected by a mental health disorder or neurological disorder at some point in their lives. Thus, we wanted to arm you with some facts on mental health, particularly in this environment. So a mental health concern is what basically many of us are going through now. It can happen from time to time throughout our lives. It includes maybe being anxious, stressed, worried, feeling sad and overwhelmed at times. And it can be a normal response to what has been happening. You know, these are normal responses that everybody has, and everybody has from time to time. But when these concerns or feelings turn into a mental illness, that's when we want to be concerned. So, for example, if these symptoms cause frequent stress or affect your ability to function in day-to-day life, such as at school or at work or in relationships, that's when you want to consider reaching out and getting additional help. Some red flags to consider are excessive sleeping or not sleeping enough, excessive drinking, substance use, a change in eating habits, whether it be eating too much or too little, thinking about suicide or hurting others. If you notice you're unable to carry out your daily activities, those are more concerning signs, and you'll want to seek help. But the good news is there's many places that you can go to for help. First of all, if you're in imminent harm or danger yourself or your family, friends, or someone around you is, please do not hesitate to call 911. 911 is where it is. It's there for you. So that's the first source of resource in case there's imminent danger. But for other concerns, you can contact the Substance Abuse and Mental Health Service Administration's Disaster Distress Helpline. That's at 1-800-985-5990. There's also the National Suicide Prevention Lifeline at 800-273-8255. And I noticed one question, thank you for your questions, one I'll address right now. I know there's a lot of numbers that are being given out during this webinar, and we'll make sure that we have that available for you all, to use as a reference. There's other opportunities that you can use to reach out to mental health professionals as needed. Your employer programs is one resource, so check with your employer and see if they have any employee assistance programs. For example, many employers have access to such sites as Ginger or Talkspace. Those are digital platforms that connect you with a clinical psychologist or mental health professional. There's also your primary care doctor, and I know that during this time we want to practice social distancing and be responsible, but many primary care doctors are offering telemedicine visits. There's also purely telemedicine consultation services and digital apps such as with Teladoc, American Well, or Doctors on Demand. So please feel free to reach out to those resources as needed. We're all facing challenging times during these days of COVID-19, and we want you to know you're not alone. COVID-19 is affecting people and families across the world, and we're here for you at EHE Health. With that said, I'd like to address some of the questions from our audience. Please feel free, everyone, if you have any questions that you'd like us to address, myself or our health mentors here, Athir and Janine, please use your Q&A button at the bottom of your screen. I'll go ahead and check some of the questions we have now. The first question here is, I'll have Athir, you answer this one. What is a good way to start a meditation practice?
Yeah, thank you. Thank you for that question. Well, as I mentioned, good news is you already just tried one, and one of many other breathing techniques and exercises. Meditation doesn't have to be an intimidating thing to start. You don't have to become, a Zen yogi overnight, but there are a lot of awesome resources just to help you start. Even just simply focusing on your breath, just being aware of your breath, is the first step of meditation. So even as you inhale, just being aware that you're inhaling, exhaling, slow, deep, focused breathing is one technique to start. Sometimes, we have a lot of distracting thoughts that pop in our mind, and sometimes that discourages people from meditating, but that's completely natural. That's what your mind wants to do. It wants to inundate you with thoughts, just like the news channels and alerts that come in on your phone. But meditating over time, it takes a little while until we can kind of turn off those thoughts. I give the example sometimes, like at night, as soon as your head hits the pillow, you start having a lot of thoughts come into your mind. It's kind of like you're not totally shut down from your computer, you've logged off, and you have all these programs still processing in the background. So in order to really shut that off, we want to redirect our anxious or any normal thoughts to something healthier, like focusing on our breathing, and eventually we can quiet the mind and put a little space between us and our thoughts, because it can be overwhelming if we're just kind of listening to those thoughts over and over. So either focusing on, counting is another easy breathing technique. So inhale, count 1, exhale, count 2. That can help you just stay focused. Another easy one is just as you inhale and exhale, notice the rise and fall of your chest and your belly. So if you just focus on that alone, that is a breathing technique. If you like to do more guided meditations, you can use, like I mentioned, Calm, Headspace, any kind of YouTube guided meditation. Some of them have really calming music, and there's a lot of also body scans. So it gets you kind of from head to toe to focus on the different areas of our body, because sometimes we're not even really noticing where our attention is. But if you kind of close your eyes and kind of go with the guided meditation and focus on each different area of your body, first of all, that redirects your thoughts, and also it's going to make you feel more relaxed, and it definitely helps with sleep. It's something I use, like the Calm app every day. I love their sleep, like they have bedtime stories, they have these guided sleep relaxation. So there's a lot of information and resources, and also, you know, in the health mentorship program, these are things that we can guide you through. And many of you might have, through your partner programs, access to Calm or other kind of guided meditation apps. So just start with 5 minutes a day, make it a routine, maybe when you first wake up or at the end of your workday, to kind of, you know, especially now to maintain some sort of work-life separation. Maybe at the end of the workday, you take 5 or 10 minutes to yourself and meditate, kind of decompress, shut off the computer in our mind, and then you start your evening. So those would be some of my suggestions.
Thank you. Those are great suggestions. We have a couple more questions here. What would your advice be for someone who's dealing with other physical health issues in this timing where they cannot get adequate help they need with closing health centers and doctors not taking new patients? That is an excellent question, and thank you for reaching out. I think a lot of us are facing this issue, and also not wanting to physically go to doctors' offices to protect ourselves and others, you know, from COVID-19. You know, there's many resources. First of all, check your insurance. Many insurances are offering telemedicine options. So if you have a primary care doctor, you can reach out to their office. Many are doing telemedicine visits, so they can talk to you and adequately steer you into what you need, whether it be an in-person visit, an urgent care visit, the emergency room, you know, where do you need to go for adequately addressing the physical health issues. There's also several platforms online. There's Teladoc is one, Doctors on Demand, American Well. Those are websites you can go to, you download an app, and then you're able to do a telemedicine visit. So you speak face-to-face with a physician, and they can address the concerns you need, as well as identify resources where you can go to wherever you are geographically to connect you to the appropriate care. So that is a great question. I just also wanted to note there was another question about, excuse me one moment. We will be getting, you know, about the websites and references that we mentioned. We will be sharing the websites and references mentioned along with a recording of this webinar up on our COVID-19 portal at COVID19.ehe.health. That's COVID19.ehe.health. Great. Yes, so there's a great question here. My wife is a psychotherapist and under a lot of mental stress as her clients need her more than ever. Well, first of all, thank you to your wife for providing her care and to all the professionals and all of us working from home during this time. You know, I think that that's an amazing thing and such a beautiful thing that we can do for each other. Do we have any ideas on how to support her well-being? That's great. What I'll do is I'll have you, Janine, answer that, and I'll also add on as well as Athir.
Thank you. Yes, I just want to say that, you know, even if you're a health professional with all the knowledge, you still need to reach out for help. And knowing the signs is really good, as your wife probably knows the signs, and it's a lot to take on other people's stress when you're also dealing with the same stress. So I think reaching out for help to another professional is advisable at this time if they're feeling like they need to talk through some of the things they're going through and being able to help others in the position that she's in.
Yeah, that's especially important. Oh, sorry.
No,
if you want me to jump into that one.
Yes, please do.
Yeah, I think that's especially important right now. Everybody needs support, especially the people out there like your wife who are, you know, giving their time and energy and and using up a lot of their own, internal resources, they need to refuel as well. So maybe I agree with, seeking another professional for support, but I know your question was, how can you support her well-being? Maybe think of relaxing things that, run a bath for her, or say, hey, let's go for a walk and just have leave your phones and everything at home. Or say, hey, I want to try this meditation practice. Would you like to do it with me? But really also just making sure that we're inviting people and making them feel like it's their choice and not kind of imposing what we think might be helpful, or just simply letting her vent and listen. And sometimes people just need to be heard and feel validated. Sometimes the best thing to do in those situations, just let them speak and not necessarily try to fix the situation, but everyone needs to kind of decompress and vent to someone. So I would, try to think of these other things that we've mentioned and do them together, and maybe, say, hey, this is for my benefit too. Would you like to do this with me? And even those aromatherapy is something I haven't mentioned. That's a great relaxation, getting like an essential oil diffuser, or even I always have like my eucalyptus and lavender, and even these scents just alone can help boost the mood. So even just, putting some, oils in a diffuser and just creating like a more relaxing environment in the house can help everyone decompress. And just simply asking, I noticed that you might be stressed during time. How can I best support you? And just leaving that kind of open-ended question, and, you might be surprised. They'll tell you exactly what you can do. But, it's very thoughtful of you to want to be supportive during this time. And she's doing, a work that we really need right now. So those would be some of my suggestions.
That's great. I think, both of you answered that beautifully. We have another question here. I have a family member that's suffering from all of the 4 to 5 signs to be concerned about, but not suicidal. Who do you contact? Well, first of all, thank you for reaching out. Thank you for being aware. It's very important to watch each other as much as yourselves during this time. One resource to help educate all of us on mental health and what to do in a crisis situation and what to do in a non-crisis situation is the Mental Health First Aid website. It's a website sponsored by SAMHSA. It's a Substance Abuse and Mental Health Services Administration, where you can learn kind of exactly how do you talk to somebody in a mental health crisis, how do you connect them to the resources, and what are next steps that you can take to really effectively reach them and help them get the proper resources. So for this particular case, I would reach out first through your insurance to see what primary care doctors and mental health professionals are covered under your insurance. The second thing is using those telemedicine platforms. There are specific telemedicine platforms for mental health. A couple of them are Ginger, which you can go get through your employer if your employer does have that resource. There's also Talkspace, which allows you to connect with them even if your employer is not a participant. That's TALK space SPACE, and that can help connect your loved one and family member with a clinical psychologist, a licensed clinical social worker, and other mental health professionals. They also have the ability, if it's necessary, to move on to a psychiatrist or acute care as needed. So thank you so much for that question. Excellent. So, and in urgent situations, if you have a best contact for urgent situations, if it's something urgent, it's important to call 911. And connecting for those resources. But the first step, if they're not having imminent danger, would be through the resources I mentioned. There is a National Suicide Prevention Lifeline as well at 1-800-273-8255. Again, that's 1-800-273-8255. Great. So we have another question here. About groceries. So I'm thinking of getting online grocery delivery. How do I do this safely? That is an excellent question. So thank you for that. safely ordering groceries online, first of all, thank you for doing that. I think it's our important duty to maintain social distancing, and that's a great way to do so. And if you can, online grocery is a great way to get what you need without getting exposed or without exposing others. Right now, you know, in terms of, I know there's been a lot of information online now about whether or not you need to sanitize groceries that you come in and getting online deliveries delivered to everyone safely. But according to the Food and Drug Administration, or the FDA, their guidelines on food safety and coronavirus do not include disinfecting perishable and non-perishable grocery items. So keeping that in mind, and also keeping in mind the Centers of Disease Prevention and Control, or the CDC, the virus is thought to spread mainly from person to person. So there's two primary forms of transmission. It's between people who are in close contact with one another within about 6 feet, which is why we're asking to socially distance 6 feet, and through respiratory droplets produced when an infected person coughs or sneezes. So that being said, you know, thinking about, you know, is it possible for online boxes or cardboard, plastics, et cetera, to have COVID-19? They actually did a study about it in the New England Journal of Medicine, and they looked at coronavirus and how long it stays on different surfaces, particularly cardboard, plastic, stainless steel. On cardboard, it was about 24 hours. On stainless steel and plastic, it was about 72 hours or 3 days. But it has to account as well that the virus decays over time. So especially depending on the environment, you know, where the package is, how it's handled, et cetera, you know, that affects its infectiousness. So it's unclear how long it's infectious, but it's very important for us all to just take the universal precautions, make sure you wash your hands thoroughly, covering your cough and sneeze, not touching your eyes, nose, and mouth to reduce the incidence of any viruses. You know, if it's necessary, if you're at high risk and you feel more comfortable to disinfect packages, just do that safely. The CDC website has a list of restrictions and in eradicating coronavirus. So that is a great resource. The other thing with food and, you know, eating fruit and things like that, you want to make sure you wash it very well. Soap is not meant to be ingested. It can cause nausea, vomiting, diarrhea. So making sure you're not using that, and something that's environmentally friendly, you want to wash that very well with water, scrubbing it as much as possible. And that's the way to keep safe, you know, when you're getting these online deliveries and bringing food home from the grocery store. Excellent. So great. So we have another great question here. Yes, what was the name of the fitness app website Janine mentioned, where you can enter in how much you have and types of exercises you like? So Janine, go ahead.
Yeah, it was called Fitness Blender. So fitness and blender, like the blender you keep in your kitchen, and you have access there to those free videos. So I hope that's helpful.
Yes. Okay, great. So great, that's a great suggestion here. And we have another question here of someone living in an outside county, 5 minutes from a local hospital. They state that his wife and himself find ourselves looking at our meals and eating less because we're feeling that food should be saved for a later date when it may be harder to get. Shopping in this area feels like a life or death decision, especially since we have my wife's 89-year-old mother living with us through this. This is worsened by the number of New York license plates we're seeing shopping in our area of New Jersey. Are we alone in feeling like this? With another month or more of this to go, how do we adjust for this? That is a wonderful question, and thank you for sharing it with all of us. You know, definitely thinking about things we never thought we'd really have to think about living in this country. You know, thinking about food, how much food we have, thinking about the danger, you know, that we may face going outside of the house and getting groceries. But, you know, what I want to keep in mind is, you know, those are really wonderful, you know, trying to be as safe as possible and considerations to make, you know, but looking at the incidence of coronavirus versus influenza versus other things that we faced, HIV, so many different, the plague, going back through time, human society has faced a lot of different viruses over time. And, we are lucky at this point in time. We know a lot about coronavirus. We don't know everything, but we do know a lot. We know how it's transmitted. We know how to protect ourselves. We know to make sure that, for example, if you're feeling sick, wearing a mask, you're definitely not alone in feeling like this. What you want to do is, luckily, in terms of food shortages and things like that, it doesn't look like this is going to be an issue nationwide, because our brave people at factories, manufacturing, farming, etc., are continuing to put out groceries and things for us. What I would suggest for your particular situation is you want to go into the online categories, Amazon Fresh, Walmart, for example. Instacart can connect you to local groceries where you have it delivered to your home. When you're looking at food, you want to have at least about a 2-week supply of food in the house at all times if you can. So there's a lot of great resources. I know Athir was talking about it earlier. Doing dried beans, for example, they're inexpensive. You can get a lot of them, and it can serve and feed, a family comfortably. Getting a bag of beans for maybe, $3 or $4, for example. There's navy beans, lima beans, legumes, all kinds of lentils. So that may be a great way to kind of expand your repertoire too when you're cooking different items. Concentrating on as much fresh produce as you can, and balanced diet is important. But keeping in mind that you just want to make sure that you're providing enough for your family, but not hoarding as well, because we want to think about the whole community. So that was a great idea, a great question. Thank you.
May I add one more thing to that?
Yes.
Oh, I'm sorry. I didn't know if you.
Yes,
I was just
absolutely.
something I think we didn't address, but a lot of my clients I've been speaking to have been using meal delivery services. So if you're kind of tired of cooking, there are a lot of healthy, like there's Sunbasket. They have like a lean and clean option, Freshly. There's you can just search what's in your area, but this is a way to kind of alleviate cooking, and they continue they're continuing services the same way, and all you have to do is either they can deliver the fresh ingredients and you prepare the meal, or you can opt for the ready-made meals and just heat that up. So I know it can be stressful to just add on, how am I going to feed myself now? But there are some healthy recipes, and also some healthy meals are already pre-prepared. We can put these also in the email if people are interested in some other resources, but I do know that they are still delivering, and people are continuing with that. It might, give you a little bit more time and kind of ease your mind a little bit too, and then you don't have to go to the grocery store. But I love, the online shop, Instacart and Amazon are also really great ways to get things delivered.
Yeah. That's great. Thank you for adding that. That's exactly right. We tried Sunbasket. There's so many different food delivery options, and they kind of mix it up and make it easier to cook meals at home. That's wonderful. So it's the top of the hour now, or the end of our hour together at 1:55 here. But I just wanted to thank you all for attending this webinar. Unfortunately, we don't have any more time for questions, but if you do have any other questions, please do not hesitate to email us at covid19@ehe.health, or call our COVID help hotline. You can call toll free. It's at 844-258-1820. But I just wanted to thank you all for attending this webinar today. Thank you to Athir and Janine for providing your insight and expertise. This webcast will be available through your registration link. And again, after this webinar, please feel free to continue the discussion, continue the questions, talking and reaching out to us at the COVID hotline, and emailing us at that EHE email address, which is COVID19@EHE, it's COVID, COVID-19@EHE.health. If you've had an EHE exam, you can also email mentor me at EHE.health to speak with our health mentors, including Janine and Athir, to help you formulate a tailored plan to optimize your health. We also have a COVID health portal with additional information where this link will be available, as well as other important resources. That's at covid19.ehe.health. Be also sure to follow us on Facebook, LinkedIn, and Instagram for additional content. Again, my name is Dr. Seema Sarin. It has been a pleasure speaking with you all today. Until next time, stay safe, be well, and take care. Thank you.